Barbiturates are a class of drugs that depress the central nervous system, meaning they slow brain activity and body functions. They were widely used in the past for sleep, anxiety, and seizure control, but are now used less often due to safety concerns and the availability of safer medications. Barbiturates increase the effect of GABA, an inhibitory neurotransmitter that reduces neuronal activity. This leads to sedation, slowed reactions, impaired coordination, and decreased alertness. Some examples of barbiturates used or historically used in medicine include phenobarbital, pentobarbital, secobarbital, and amobarbital. Although less common today, barbiturates have been referred by common street names such as barbs, downers, blue heavens, yellow jackets, reds, or red devils. Barbiturates are still used in specific medical situations, including the treatment of several seizure disorders, sedation, induction of anesthesia, and rare short-term treatment of severe insomnia. Common effects include drowsiness and sedation, slowed reaction time, impaired coordination, slurred speech, and lower blood pressure, especially at higher doses. Common risks and side effects include respiratory depression, tolerance, and dependence. There's a high overdose risk, and that's because that tolerance develops very quickly and larger doses are needed to produce the same effect. And then there's an increased danger when combined with alcohol and other depressants. Withdrawal from barbiturates can be life-threatening and may include anxiety and restlessness, tremors, seizures, hallucinations, and increased heart rate and blood pressure, and that's due to the nervous system overactivity. And there's no antidote for barbiturate overdose. Barbiturates are a prescription medication in the United States and are classified as controlled substances due to their abuse potential. Their legal status varies by specific drug, so they fall under Schedule 2, 3, and 4 of the Controlled Substance Act. Because of their risks, barbiturates are rarely prescribed for routine use. There are safer alternatives that are preferred, but barbiturates remain important in certain clinical settings. So some key takeaways: barbiturates are powerful CNS depressants, that central nervous system depressant. They can lower blood pressure and suppress breathing. They have a high risk for dependence and overdose. Withdrawal is dangerous and requires medical supervision. They are frequently used for attempted suicide because of their rapid action, and they are controlled substances with limited medical use today.